A dying COVID patient whose family wanted you to know he regretted not taking the vaccine. Medical reporter Dan Gray was granted rare access to see respiratory therapists at work. Many emotionally exhausted after battling COVID for 18 months, only to see those they have tried to save lose their fight for life.
I get emotional. This has been hard because we see a lot of people die.
Sherry Pipkins has been a respiratory therapist for 30 years. She hasn't seen this much death in such a short amount of time.
We're taking care of these patients on these maxed out pieces of equipment for months and months, then only to find them on the ventilator, and then only to find their families finally coming in to make those decisions to allow them to go comfortably.
Pipkins and other respiratory therapists at SSM Health St. Joseph Hospital in St. Charles
Hi, Melvin. We're going to turn you again, okay?
are called angels on the front line with direct contact with COVID patients.
It means a lot to them when we have that compassion and we have that strive to get them where they need to be so they can get back home to their families.
They even arranged for COVID patient Melvin Allen of DuQuoin, Illinois, to virtually attend his daughter's wedding. And Sherry came to the hospital on her day off to be with his family when he was taken off life support.
And beyond kind of the clinical work that they bring, most of them are unbelievably empathetic and spend a lot of time on their own, kind of counseling patients and talking them through the different therapies.
Respiratory therapists maintain airways when patients are placed on breathing machines or ventilators.
He's just trying to give his body a rest. So let the vent do what it needs to do for him.
Now, a new challenge. A growing number of unvaccinated patients are denying that COVID is real.
What I'm seeing now, right now, in this past 2 weeks even, that some people aren't receiving of it at all. They're actually really push you away with it. They think they're sick, you're in the hospital, and people go to the hospital, they get a pill, they get an IV, or they get whatever they get. The doctor's going to make them better, they're going to go home. They don't know the reality of what we've seen for the past 18-ish months, that no, not everybody goes home.
I think sometimes it could be political, but then I think also it's the scared unknown of the side effects, so then that's why they don't get it. But when they go through this process of COVID and post-COVID and machine after machine, and we finally get them on their feet to be able to walk out of here, then it's like, where can I go to get vaccinated? Do you offer the vaccine here?
Even when COVID patients leave the hospital, their fight isn't over. Doctors and nurses, respiratory therapists say they're seeing some serious issues develop in the lungs of those patients.
But we have had an increase in adding on testing, emergent testing, to diagnose patients with a recent diagnosis of lung cancer.
No link between COVID and lung cancer has been established, but the increase in the disease in post-COVID patients is worrisome. Patients also experience shortness of breath, cough, and fatigue.
Even post-COVID, it's taken them quite a step back, and then we have to visit a higher level of care and higher demand of oxygen.
85% of COVID patients in SSM hospitals in the St. Louis area are unvaccinated.
I do believe in the vaccine with all my heart. I think it works.
All right, Mr. Allen, we'll see you later, okay? We'll be back.
Dan Gray, Fox 2 News.
Well, we want to thank Melvin Allen's family of DuQuoin, Illinois, for allowing us to share his battle and to extend our condolences.